Welcome to the State of Health. I'm your host, Karen Bowling, Cabinet Secretary for the West Virginia Department of Health and Human Resources. In August, DHHR kicked off a pilot program to help people receiving certain benefits obtain education focused on creating job skills for them. We'll tell you about that in a minute. We'll also take a look at efforts underway to make sure your loved ones in long-term care facilities are safe, and September is National Preparedness Month. Why September and what you need to know are coming up. We begin with our Temporary Assistance for Needy Families program. Our agency is partnering with Southern West Virginia Community and Technical College to provide a more case management approach to each person receiving TANF funds. We recently announced the launch at a news conference in August. Here's Toby Wagner with more.
Each student in the TANF project receives continuous one-on-one help tailored to his or her individual needs, and a plan is designed to put them on a productive career path. The individualized help ranges from financial aid to boot camp in certain classes such as English or math to child care and transportation.
Our TANF recipients are people who are out there who need our help. You know, we are West Virginia. You know, we care about each other. And the importance of caring about each other, we can't say that enough. You know, if we are going to support the people in our state to be able to become gainfully employed through an educational, whether that's certificate program or a college degree, then we have to work together.
Project leaders are also working with local employers to determine what types of skills these students need in order to succeed in graduating and finding a job.
Our entire faculty, staff, and administration stands in support of them, and hopefully we'll be able to help them maneuver through these hoops.
It's hoped this holistic collaboration to support the person will become a model statewide. For the State of Health, I'm Toby Wagner reporting.
We are excited that this program is now up and running at Southern. Also in August, our agency launched a program to reduce the potential for abuse and neglect among our most vulnerable population, residents in nursing homes and other agencies that provide services to this population. It's called West Virginia Cares. And joining me to talk more about this is Meghan Shears, Program Manager for West Virginia Cares. Meghan, thank you for being here.
Thank you for having me.
I know we're very excited about this program. It's something that we've talked about for a long time, and now we've seen it come to reality. Can you tell us a little bit about what the program is and what it means for West Virginia?
Sure. West Virginia Cares is the West Virginia clearance for access, screening, and it allows us to add the additional federal background check. We've always had to do the state background check for all our long-term care employees, but this will allow us to add that extra layer of protection in the pre-screening process and the federal check.
I mean, I think we all know that it's important to protect our long-term care residents, and we need to understand how does this work, and really let the viewers understand, you know, the importance of checking employees that are going to be taking care of, again, this vulnerable population. How does this work in that system?
So West Virginia Cares allows the employer to go in and pre-screen against several different abuse and neglect registries to ensure before they even have the person fingerprinted that they're going to be able to clear the background check. Then we send them for a state and a federal fingerprint-based background check. This allows us, if someone's not honest with where they've lived or worked, we can capture the whole picture.
And again, that's very important for protection purposes.
It is.
Now, I know this was legislation that was just passed recently in our last legislative session. Tell us about the support that we received for this legislation.
We really received a lot of support from the legislature. We actually passed both houses unanimously. We were extremely excited, but that shows that also the legislature knows the importance of making sure that these people are protected.
Well, I know the governor, you know, was actively involved in supporting this legislation as well, and I think all of us here at DHHR felt very strongly about it, as well as the legislature. I know we had some community partners working with us. Could you tell us about that?
We did. We had the West Virginia Healthcare Association has been extremely helpful in this process. getting us in contact with the nursing homes and the assisted living facilities. They've been a partner in helping write the legislation, and they've just been there behind us through the whole process. We also had the state police who backed the legislation also and have been huge supporters, and because they see the importance of making sure we capture the whole picture of the backgrounds of the people that are employed in long-term care.
You know, I know that one of the jobs at DHHR is to ensure that we are protecting our population and ensuring that they're receiving quality care, but it's also safe. And
Yes.
I think this adds another level of safety, and that's why we receive so much support, and certainly appreciate the state police and others that were involved in that. I also know that there's a phase-in period for this legislation, because
Yes.
we do have in our state many people who are in residence where employees are taking care of them that really will have to have this background check. Can you tell me a little bit about that phase-in?
Sure. We started with the nursing homes, and we are phasing the state in by regions. So we're looking at the whole state, the different provider types across the state, and we're going to phase each region in and hope to have everyone in using the system by the end of 2015.
That would be a great accomplishment. It's pretty exciting to think about. We could get all that done in that period of time, and I know it takes a lot of work from your team and the people that have been involved, and I appreciate really everyone supporting that. I also know that it's good to let the public know we've always done background checks.
That's right. That's right.
So the fact that we're adding another layer of protection is just something positive, I think, for our state and for the people who are in long-term care residents, or really could very well be at home but being taken care of someone.
That's right.
So could you tell us the various groups that will be required to have this type of check?
Sure. It's all long-term care is covered by the West Virginia CARES Act. That includes nursing homes, assisted living, home health, personal care. So we do have people that are going to be in these clients' homes. You want to make sure that you have the safest possible person there. We also have hospice will be covered, other long-term care facilities that provide any sort of assistance to these people long-term, and these clients are going to be covered by this. We should cover approximately 1,000 different providers and facilities across the state.
Wow, that's impressive that we're going to the extra mile to ensure that we're
Yes.
doing the right thing by the people that we serve. I know we received a grant to get some funding for this to start this. Could you tell us a little bit about that grant?
This grant came from the Center for Medicare and Medicaid Services. It was initially a 3-year grant. It's been extended to allow us to continue the work here in West Virginia and make sure that we get the full system rolled out to everyone across the state. It's been a blessing for the state because they've helped us with the design of the online system. They've helped us with legislation. They've really provided a lot of support through this grant, not just the money, because they know that this is important not only in West Virginia but across the nation.
Now, I know that we're going to be one of the few states that really has gone to this really extra mile, that has really focused our attention on this. And that's one reason that we received the grant. In essence,
right.
we are really piloting this, and hopefully other states will follow suit. Is this something that's common practice in other states?
Every state has some sort of background check requirement for their long-term care facilities. We have the benefit now of having the legislation, and we're one of few states that actually has the legislation that allows us to provide the additional federal check. There's not too many states out there that have that, so we're ahead of the game on a lot of this.
I love it when we can say we're ahead.
That's right, I do too.
We're doing great things for the people of West Virginia. Thank you, Megan. I appreciate you being here.
Thank you so much.
When we come back, we'll talk with the head of the state's Healthcare Association about West Virginia Cares, plus what you need to know about long-term care. Stay with us.